Let's talk about one of the most common and easily fixable issues in scleral lens wear: bubbles. Bubbles can interfere with vision, cause dryness, and signal a mechanical flaw in the fit. Here is the good news. They're typically straightforward to troubleshoot using Maxim 3D's zonal design system. Let's review what you're seeing. Central or peripheral air bubbles under the lens are usually bubbles that remain stationary. They don't shift with blink. They can create localized blur and dryness during wear. Here is what causes bubbles. It's a common misconception that bubbles result from a centrally steep lens. In most cases, they're caused by edge standoff, a subtle gap between the landing zone and the scleral surface, or from improper insertion technique. Air enters through these gaps during or just after application, typically from a quadrant that isn't properly aligned. Some contributing factors include an incomplete bowl fill during insertion, head tilt or misalignment during the lens placement. Lastly, overly flat PC4 or landing zone geometry. Here is how to fix it. Number 1, re-educate the patient on insertion technique. 2, fill the lens bowl completely with non-preserved saline. Eliminate all air pockets and instruct the patient to keep their head parallel to the floor when applying the lens. Use tripod hand support, 2 fingers and a plunger, to stabilize lens application. Emphasize lens alignment, with no tilt or angle. Next, steepen the edge or landing zone. If peripheral bubbles persist, steepen the PC4 or landing zone in the quadrant where the issue appears. Use toric, quadrant-specific or free-form landing options in Maxim 3D to refine edge seal precisely. Steepening closes the gap and prevents repeated air entry. Here is why it works. A steeper landing presses gently into the sclera, improving seal integrity. Flat zones can tent or stand off, inviting air or tear excessive exchange. With Maxim 3D, you can fine-tune the periphery independently, leaving central and limbal zones untouched. Clinical tips include: if a bubble appears inferior temporally, check for edge lift or a mismatch in that quadrant, and steepen the PC4 locally. We suggest starting with a 25-50 micron adjustment, recheck with fluorescein, and confirm full seal across all quadrants. Our final thought: bubbles typically point to edge problems, not excessive vault. Application technique and landing zone geometry are your key levers. Maxim 3D gives you the zonal control to fix this without remaking the lens. Steepen the edge, reinforce proper insertion techniques, confirm with fluorescein, and proceed confidently. Refine the fit. Don't replace the lens.